coming from different places. 3rd May was asthma or asthma, the way it is called, day. And I thought, let me go with some of the practices in which I can show, some of the practices which can be done very easily by asthma patients. In fact, there are a lot of things in yoga which can be done and that can help you with asthma. A lot of cleansing process, a lot of breathing. One thing it is very important to understand that during asthma के दौरान basically आप आपकी जो सांस छोड़ने की कैपेसिटी होती है दैट इज काइंड ऑफ ब्लॉक. सो सांस लेना तो वैसे काफी आसान हो जाता है, लेकिन जो सांस छोड़ने की प्रक्रिया होती है उसमें काफी तकलीफ होती है और वो कहीं ना कहीं ब्लॉक कर देता है. तो हर एक प्रैक्टिस, ऑल दोस प्रैक्टिसेस which really help you in exhalation, those are good practices especially for asthma and bronchitis. So I'm just going to show you 3 simple practices which can be done by anybody at any level or the severity of the problem. You can do it sitting on the chair, on the bed, like not lying down for sure, but sitting you can do that. Yeah, you'll have to make sure that you are empty stomach. I mean, तुरंत खाना खा के आप ये नहीं कर सकते हैं, तो आपको you'll have to have empty stomach if you have eaten something, say an hour and a half back, something light, you can do that, but you can definitely not do this one with a full stomach. So the 3 practices I'm going to show for the patients suffering from asthma, bronchitis, and which can be done, and that will give you immense relief. So the first practice is Shwasan Marg Shuddhi. As the name indicates, Shwasan is the breathing, Marg is actually the passage, Shuddhi is actually the cleansing process. So with the first practice, which is called Shwasan Marg Shuddhi, we are going to clean the passage of the breathing. It's a very simple practice, okay? So for that, what do we need to do? We inhale completely, okay? Once the inhalation is done, we use both the thumb, we block one nasal passage, we open up the other nasal passage, and we go on exhaling forcefully. Remember, when you're exhaling, also use your tummy, like literally push it in so that everything is thrown out of your nasal passage. So we are starting with the first practice. It is called Shwasan Marg Shuddhi. Okay, I'm inhaling up to the brim. So inhale as much as you can. Okay, thumbs are up. I'm blocking my right nasal passage, okay, and I'm opening up my left nasal passage. Now, blockage is like this area which is protruding out. You're just kind of pressing very gently over there. You're not kind of turning the nose to that side, okay? So very gently after pressing, get the other thumb to open up the nose. So again, I'm inhaling up to the brim. See, I blocked, then I opened this way, and I'm going on exhaling. It's pretty much like Kapalbhati with one nasal passage. This may not go for a very long period because this is much faster in speed compared to Kapalbhati, and because it is very fast, you will not have much space to inhale. Okay, so we are starting now. Inhale completely, block, open, and go on exhaling. Hand down. Chances are that you will be wanting to inhale because the process is very fast. Okay, so once you release, wait for a few seconds, then go with the other nasal passage. So again, I'm inhaling up to the brim, blocking the left nasal passage very gently, opening up the right one, and going on exhaling forcefully. Yeah, this is a forceful exhalation. That was one set. I'm just going to show you one more set so that you have the right clarity. So you inhale up to the brim as much as you can, block your nasal passage, open up the other one, and go on exhaling. Once you're done with this practice, by default, your breathing will stop. Okay, so Watch for a few seconds, enjoy that, that spontaneous pause of the breath. It's pretty enjoyable, okay? And that can be for a longer period of time for normal people, maybe not for people who are suffering, but for normal people it can be a thing, for a longer period of time, okay? Now the next one, just 1 minute. Yeah. The next practice is Kapalbhati. Kapalbhati is a very popular practice. I mean, everybody, I guess, would have definitely heard about it, and they would have practiced it somewhere, sometime in their life. Okay, so Ranju, these are also very helpful for sinus. These things are very helpful. Of course, Jalniti is also one of the most recommended. I'll come back to the questions, but let me just finish that. Okay, so I'm going with the second practice, which is Kapalbhati. Kapalbhati, for people who don't know how to do Kapalbhati, like, recently I'm working with an old lady. She's around 79, and it's very difficult to make her understand how to do Kapalbhati. So for people who don't know how to do Kapalbhati, the first thing what you need to do, you only exhale. Just get your tummy in. Those who don't know how to do Kapalbhati, just get your tummy in. If you're not able to do this as well, sneeze. Like, how do we sneeze? See, though Kapalbhati doesn't involve this kind of movement, as a beginner, when you don't understand, I'm showing you. So sneeze. See, this is absolutely for beginners who don't know and they're trying to figure out how to do that. Okay, once you understand these two things which are predominantly involved in Kapalbhati is forceful exhalation. Okay, so you're making all the effort for to exhale forcefully. Because the exhalation is forceful, as the tummy is going in, the air is coming out of your nasal passage and it is striking, into your nasal passage somewhere over here. The sound will come. So the sound is important. Make sure that sound is not mechanical. There is very direct connection between the stomach and the nasal passage. So I'm starting with Kapalbhati. There are a lot of problems with Kapalbhati. When people do Kapalbhati, a lot of time they end up with back pain. They end up with some, lot of movement in the spine. The chest is moving, the spine is moving. In fact, that could be damaging to your spine. So you'll have to make sure that your spine is tall. So like I'm sitting tall with my chest wide open, shoulders are relaxed but slightly at the back. You'll have to sit like this. Okay. Once you sit like this with your spine tall, you will inhale. When you inhale, because inhalation is a lifting process. When you inhale, very gently, with inhalation, सांस लेते हुए छाती को ऊपर की तरफ लाएं. So if I say this is your point, like say the line on the nipple point, इसको pull it up और उसको आप यहाँ लेकर आए. यहाँ लाके इसको lock कर दें. Remember, you're bringing the chest up over here. I mean, this part over here, you're not bringing it into the throat. The moment it comes in the throat, it will be a stress. So we don't want any kind of stress. So I'm inhaling, bringing the chest slightly up, okay, slightly up over here, locking it over there, and then going on exhaling. Okay, Kapalbhati is a forceful exhalation, a process of forceful exhalation. You're not making any effort to inhale. There is passive inhalation which happens in between both the strokes. So do not make an effort, only focus on exhalation. So you will check your spine tall completely, you will inhale. See, I lifted myself. I elongated my spine when I inhaled. Okay, no curvature at the back. Your spine is tall. So as I'm inhaling, see, lock, and then go on exhaling forcefully from the stomach. See. When you exhale, by default, there will be breath retention. That's very much enjoyable. So please enjoy that. Okay. So that was like a few more things I want to explain about Kapalbhati. You should not have frowning face. So when you're doing Kapalbhati, this should not happen. One is this one. No, this is wrong. Okay. Your face needs to be relaxed. See. So face needs to be relaxed. You cannot slouch, cannot, not should not. You cannot slouch. If you slouch, you will end up with back pain. So you are not supposed to do this, okay? Your spine is tall and neutral completely. Holding on to that, you're going with Kapalbhati. And the third thing, when you do Kapalbhati, focus on the area below the chest, the bones over here, as if you're striking hard below that. When you do that, you will really have very strong practice of Kapalbhati, and along with that, you will work on the physical level, on the muscular level, and you'll feel a lot of pain. So this area will be toned. Okay, so these were a few things to remember during Kapalbhati. Now, the third practice for today. It is one of the most recommended practice. Many of the hospitals, especially in the US, they actually teach those practices to the patient in the hospital. It's called, and I think a lot of time, and or whenever I talk about asthma, bronchitis, I definitely talk about that. So that is called pursed lip breathing. As the name indicates, you're pursing your lips. See, pursed lip, you're breathing from pursed lip. So what you do in this one, you inhale up to the brim. Once you inhale, you just pause for a second and you exhale by creating a very small, tiny shape, O shape maybe, or maybe a slightly oval shape in between the lips. And as your stomach is going in gently, the air is coming out from that area. So that is what we are doing in pursed lip breathing. So inhale gently. See. This simple practice can be one of the most effective one. You can start very gently with 10 rounds and then you can just take a break and do that. You can do it throughout the day. And like the patients I have worked with, even when the case is very severe, this they find really helpful. So you really want to include these three practices in your regular practice, in your daily practice, and not only once but a few times a day. So just to recap quickly, there are three practices which I have shared with you today, specifically for asthma, bronchitis. The first one was the Shwasan Mark Shuddhi. You inhale up to the brim, block one nasal passage, open the other one, and go on exhaling. See. Stop. If the mucus is coming out, allow it to come. That's absolutely fine. The second practice is Kapalbhati. You inhale, okay, raise your chest up, lock it, and go on exhaling. Do follow the do's and don'ts, okay? And the third practice was pursed lip breathing, in which you inhale up to the brim, okay? And then you gently, create a small shape in between the lips and exhale through that. See. These were the three practices. I think for any kind of problem, you will need to watch your lifestyle so that the problems can be sorted out. However, doing these practices will add value to the whole thing. At least it will give you some of these will give you immediate relief. So keep practicing regularly and just check, how can you can benefit from that and you can get out of your problem. There are a lot of other practices which I'm going to show next time. Okay. Now, anyone